6:41. An estimated 800,000 people in the UK have dementia, and over the next 2 decades, that number is expected to double.
Today in London, David Cameron will launch the world's biggest dementia study. It comes as the government warns we need to do more to fight the disease.
Well, we're joined by the Health Secretary, Jeremy Hunt. Very good morning to you.
Good morning.
What more are you calling for?
Well, I mean, the first thing is this is an absolutely horrible condition, and you are brilliant on this programme about talking about it a lot, and that is the right thing to do because it's the single condition that people over the age of 55 are most frightened about. It devastates families. But we should remember that, you know, as mankind, we have defeated diseases in the past. 160 years ago, we had the cholera outbreaks in London, and we've basically conquered cholera. And what David Cameron is saying is that dementia is, alongside cancer, one of the greatest threats to humanity, and we've got to do something, and he wants to find a cure by 2025.
Will it be funding from the government that's going to help this research?
Well, we've tripled our funding research into dementia, but we can't do it alone, and that's why he's called this global conference, and he's got the drugs companies there and the universities and representatives from other countries, and he's saying, what would it take for a global effort over the next decade to actually find a drug that will stop this disease in its tracks, because it's not an automatic part of ageing. A lot of people think it is, but it isn't, and we really could do something about it.
This, of course, all comes at a time when the NHS under so much pressure financially, and we have this news this morning about a nursing crisis. Figures from the OECD saying that there are currently 8 nurses to 1,000 people in the population. That is down from almost 10 nurses per 1,000 people 5 years ago. If we're facing so many people needing more care just on this particular disease, dementia, why are nursing staff decreasing?
Well, they're actually going up. We've got 3,000 more nurses in the system than we had in 2010. And I think one of the shocking things about the mid-staff scandal was that it revealed how many wards in our hospitals are short-staffed across the country. And later this month, for the first time, we're going to be publishing the nurse staffing ratios for every hospital in the country, because particularly people with dementia need really good nursing care. They sometimes find it hard to feed themselves. They can get forgotten because they don't kick up a fuss. They're often the quietest patients, but they can also be the most challenging ones. So we absolutely need to have the right numbers of nurses in our hospitals, and we are doing something about that.
And also, of course, we have news today of, you know, and it was discussed yesterday, of course, NHS has to save £2 billion. I mean, you're talking about trying to increase staffing, trying to deal with really sensitive, difficult, vulnerable patients, and saving money. This is an impossible situation for the NHS, of which you're in charge.
Well, it is challenging, but you know, we in the NHS are so committed to the NHS as a country, and over the last 4 years we've made around £20 billion of efficiency savings so that we can reinvest in the front line, and we've used that money to buy more doctors, we've got more nurses, and we'll continue doing that, and I'm sure we'll be successful because every single doctor, every single nurse, or every one of the 3 million people who use the NHS every week want to make it a success. And let's remember the good news as well. This week, the Commonwealth Fund, which is a respected independent think tank based in Washington, said that the NHS was the best healthcare system of 11 major countries, and they ranked it, and they said we are top for having a patient-centred system, we're top for safety, so we're doing well in other areas too.
All right, Jeremy Hunt, Health Secretary, thanks very much indeed.